Hi, do you snore or does your partner snore? You want to have a good sleep? Let us know about snoring and obstructive sleep apnea. Snoring is a sound produced due to turbulent airflow in a narrow airway passage. Airway passage here I mean from the tip of your nose up to the vocal cords. This area is compressible during sleep. So this sound is produced. So it is a problem for people sleeping around you. When does it cause a problem to you and your health? It causes when it progresses to a condition called obstructive sleep apnea. In obstructive sleep apnea, your airway is so narrowed, the passive breathing during the sleep is not good enough to overcome the obstruction. So what happens? Your breathing stops. Once the breathing stops, the oxygen levels in the blood falls down, which is picked up by the brain. It breaks your sleep cycle, wakes you up. Subconsciously, you take an active deep breath and go back for sleep. This might repeat again and again. Unfortunately, if your brain centers are a little bit slow in picking up these changes in the blood, your heart is under tremendous pressure because it requires oxygen throughout. Your heart might fail. This is the risk which is there, and this is what the concern is. What are the symptoms of obstructive sleep apnea? The symptoms are severe snoring, difficulty of breathing at night, it could be choking episodes, excessive daytime sleepiness, early morning headache, or a non-refreshing sleep. The other risk factors associated with OSA is your obesity, hypothyroidism, diabetes, and hypertension. So how the weaknesses in which children are, or how safe is your sleep, and what should we do to get out of these problems? There are two things. First thing is to know what is the severity of the problem. We'll get to know that by doing a test called as a polysomnography, otherwise called a sleep study. A detailed analysis of sleep will be done. We'll get to know how safe is your sleep. Second thing is drug-induced sleep endoscopy. This is done in a hospital setting where the sleep is induced with the help of a drug, and a flexible scope is passed from your nose up to the vocal cords. We'll get to know where is the area of obstruction. Is it because of a bone deviation? Is it because of a turbinate problems, adenoid tonsils, thick tongue, narrow lateral walls of the throat, or a floppy epiglottis? So once you know how much is the problem and where is the problem, we can decide the treatment protocols. The basic treatment plan is to reduce your BMI. Lifestyle modifications, diet changes, stopping of alcohol and smoking, and exercise is the basic concept. Second thing is to use a CPAP, continuous positive airway pressure, where it is an airtight mask is placed on the nose when you sleep. The machine gives you positive pressure and your obstruction in the airway is taken care of so that your breathing is good during your sleep. The third thing is the surgical correction. It depends on the level of airway which is involved. The most commonest procedure performed is uvulopalatoplasty, which corrects your upper throat, where it increases the space for you to breathe. So I don't have to tell you how important is the sleep. Get your snoring evaluated, have a good sleep, safe sleep, and a soundless sleep.